Just 6% of physicians in the United States consider themselves Latino or Latina, despite that population representing 19% of people in the country.
But there are bright minds working right here in Western New York to bridge that gap. Our Sarah Minkwitz spoke with some local Latino physicians about bringing more representation into the medical field.
On the side, down below, too slow. You did not pass.
Pediatrician Dr. Giovanni Perez grew up in Ecuador. His career in medicine has taken him to places all around the U.S., from Miami for residency to D.C. for training, to now Buffalo, where he admits he only knew a few things about this city.
It was interesting. I didn't know much about Buffalo besides obviously the snow and the bills.
He quickly learned another fact.
There is a significant number of Hispanics in Buffalo, especially from like Puerto Rico.
Dr. Perez saw a need for more diversity and representation in healthcare.
The Hispanic population that just continues to grow in the U.S. is something that is likely not going to change. So having the ability of like people to speak their language and understand, not, as I say, is not only the language, is understanding their culture, religion, what happens, and is extremely helpful for patient care. All right, sir, big breaths.
When his patients arrive to his office at UBMD Pediatrics on Main Street, they feel right at home.
It's amazing when you can talk the same language and then you can actually provide cultural care. So you understand a little bit more of the background, what they're going through. And when you have a patient in the clinic or like a parent, that as soon as you start speaking Spanish, you can see how the eyes light up.
Now Dr. Perez is leading the charge to inspire future doctors and nurses to tap into their culture and backgrounds and offer the same quality care to patients.
Even when you speak the same language, communication can be an issue, but imagine what happens when somebody doesn't speak your language. We do have like interpreters that can help, but it's not the same. And it's not only the language, it's kind of like that cultural background, like you know how you talk to another Hispanic parent. Improves outcomes. There's many papers in the medical literature that show that cultural competence improves outcomes.
You learn not just about diseases, but what affects certain populations, and I think that's very, very important for someone like me who wants to treat the Hispanic community.
Judith Alvarez is in her second year of med school and is the president of the Latino Medical Student Association at Jacobs School of Medicine. Her family is from Cuba.
It's like a huge honor and privilege to even get here. I think the journey to getting here is very tough and often even tougher, I think, for, minority groups.
That's why she's passionate about working with the Hispanic community here in Buffalo.
We want to unite and empower medical students in particular to really care for the Hispanic community and really provide a place for all of us to kind of congregate and kind of talk about our shared cultural experiences.
Through the Latino Medical Student Association, she organizes meetups where med students can learn Spanish.
Even being able to say a couple words, I think, really goes a long way with patients.
Something she's experienced firsthand during her schooling.
It's been really rewarding for me to be able to use my own language skills and my own background to connect with these people in the community and kind of provide a safe space for them.
Just as Dr. Perez does.
Just to showcase that you can achieve all of these things and be part of the community and try to have outreach programs, work with the community where they are, showing them that yes, this can be possible and just work together.
Sarah Minkwitz, News 4.